What are these bands, these and these, sticking out of my neck, making me look like a lizard? These are part of your platysmal muscle, which is a thin sheet-like muscle that spans your neck. So let's get into what they are, why they happen, and how we can soften the appearance of them. The platysmal muscle runs from the jawline down to the collarbone, and as we age, this muscle can become hyperactive, making our neck look aged, strained, and contribute to the appearance of neck laxity. Because these bands attach all the way up to the jawline, over time you have this cumulative downward pulling effect, making, as we age, our jawline look less defined. So why are these bands showing up now? This could be just genetic or age-related changes, normal aging changes, or it can be due to repetitive use. Oftentimes my weightlifters see really prominent bands because they're constantly straining when they're squatting or deadlifting using that neck muscle, or possibly recent weight loss. If you've had a lot of weight loss in your neck or jawline area, that subcutaneous fat that used to camouflage those bands are now gone, so it's exposing those bands. There could be multiple reasons or causes as to why your bands are more prominent these days. So how do we soften the appearance of these? You can use Botox or any tox brand to inject directly in the platysmal bands. Now this softens the appearance of them temporarily, but the long-term benefit is huge because remember, you're getting that downward pulling effect on that jawline. So if you can block that function over and over and over again, you get this cumulative bonus of not having that downward pulling effect, and over time will contribute to slowing down the age-related changes that we experience in our jawline. So how do I treat these bands? I use any of the tox brands, but my goal is to treat the bands that are more prominent. You typically have 4 bands that are exposed. So I'll show you my bands. You could see my lateral ones are popping out right here. I'm looking at a mirror in front of me. Lateral ones are popping out right here, and then the 2 anterior ones are really the ones that contribute to that turkey neck that we experience over time. So I really like to focus on the 2 anterior bands. What I do is I do about 2 units per poke, about 10 to 12, 10 to 15 units per band. And what I like to do is I have the patient go so you can really grab on to that band and then inject them once you have that band in your hand. So I grab onto that band and then I'm doing poke about 2 centimeters, 1 centimeter apart, 2 units per poke. Now, I like to focus my pokes mainly on the upper part of that platysmal band because that's where it's attaching to that jawline and you get that cumulative downward pulling effect. So I like to start really high up on that platysmal band and start 2 units, 2 units, 2 units, 2 units. I don't really focus on the lower part. My goal is really to concentrate on that upper part of the platysmal muscle. And I'm just injecting that platysmal band, each band. Now, if they don't have lateral bands that are prominent, I'm not injecting them. I'm only injecting the ones that have the capacity to have that downward pulling effect. Now, with that, you can also add something called the Nefertiti lift, which is injecting the platysmal bands, but then riding along the mandible superficially and injecting neurotoxin or any tox brand along the mandible. This will all contribute to a beautiful, softer appearing jawline. If you've never treated the lower face with tox, it can seem extreme. I totally hear you. But we're constantly freezing our forehead, softening our crow's feet, softening our 11s. We forget that our lower face is also changing. So we have this youthful face, but then our neck is still experiencing those age-related changes. So it's important to have this cohesive result. So adding in the neck and treating the platysma really creates this harmonious result with your neurotoxin treatment. Now, what's incredibly important is to talk side effects with your patients. With every neurotoxin treatment, there comes side effects, potential risks with any injectable. So I always make sure to sit my patient down and explain the side effects of treating the platysmal bands. The number 1 side effect that is most common is feeling neck weakness, specifically for my fitness people. The reason I stress this so much is because the first time I treated my platysmal bands, I experienced this and it was a bizarre feeling. Now, after the first treatment, it's become my normal feeling and it doesn't bother me whatsoever. But it's important to educate your patients so that they don't feel like something's wrong. For example, you'll experience this cumulative neck weakness. It doesn't mean that you can't hold your head up, but where I noticed it the most was when I was doing maybe a sit up and I had to support my head. I felt that my head felt a little heavier. Or, for example, in a plank position, supporting your head upright, you feel like your head feels heavier. Now, this is a feeling, again, that you get used to, and it's not that anything is wrong. It's exactly what you should kind of feel. Just like when you injected your forehead for the first time, it almost feels like there's a band around your head because you're so used to that full range of motion in your brows, right? And now we're trapping it. It feels odd at first. Over time, that feeling completely becomes your norm. Now, the more rare, incredibly rare side effect is the experience of difficulty swallowing or something called dysphagia. Now, I haven't had this experience with the patient, but I still like to discuss it so that they're educated. The only reason this would happen is if an injector overdoses or improperly injects the neurotoxin or tox in the platysmal bands. If you go too deep or you overdose that neck muscle, you may experience signs of or symptoms of difficulty swallowing. Again, incredibly rare, and when done correctly, this should not be a concern. If this does happen, please contact your injector. If this happens to your patient, please make sure that you're following up with them and you're making them comfortable throughout the experience. But that's an incredibly rare side effect, but every patient deserves to know what the risks are if they're choosing to have a treatment performed. So, injecting the platysmal bands can have a beautiful short term aesthetic benefit and a huge long term benefit, stopping that downward pulling effect. I love, love, love adding these to my tox treatments for all my patients, and I'm planning on doing mine this week because they are very much due. These results last about 3 to 4 months. So, every time your tox patient returns or every time you return as a patient, I always love treating the platysmal bands. So, hope this helps. So if you enjoyed this video, I plan to do more educational videos. My goal is to just share all of my secrets, all of my lessons, and everything I've learned over the years. So please hit that subscribe button. Help me get to 1,000 followers. I want to continue to do this for you guys because it truly fuels my heart to just pour into other injectors and educate patients on the pros and the cons of all things injectables.